in our mission and vision, instilling excellence in electrical profession. Having a dynamic professional association.
Okay, good day everyone. Once again, this is Professor Roger Flores of the Department of Electrical Engineering of this university, Central Mindanao University. The professor of this subject EE73, Basic Occupational Safety and Health. Okay, for today, we are going to discuss Chapter 2 of our subject. This is entitled Health and Safety Management. To start with, we have this second chapter, chapter number 2, Health and Safety Management. Okay. These are the contents of our chapter 2. What is management? Then how it differs from the administrative or the managerial administration, and at the same time how it is different from health and safety management, no? Okay, supervisors and health and safety, successful health and safety management, quality management, and health and safety. Okay, the last topic here is risk management. How you're going to manage risks. If we cannot go away with risks, if we cannot avoid risk, then we have to manage that risks. Okay, what is management? Okay, so basically, this is the effective use of resources in the pursuit of organizational goals. Okay, so that is organizational or management per se, no? So, effective use of resources. So, talking about resources, we have several types of resources. We have the human resources, we have the material, the resources which is tangible or non-tangible resources, no? So, if we can use these resources effectively, based on the organizational goals, then we have this successful management, no? So when we say effective, we have here implies achieving a balance between the risks of being in business and the cost of eliminating or reducing these risks. I mentioned a while ago that if we cannot go away with these risks, then more or less we will be, if we cannot eliminate it, then maybe we will be able to reduce, no, those risks. Okay, so that is effectivity or effectiveness with regards to the use of these resources to achieve these organizational goals. That is the management. Okay, so management entails leadership. Okay, so that entails leadership. How good manager you are, then at the same time it entails how good leader you are. Okay, authority and coordination also with respect to resources, together with planning and organization. Okay, so management, of course, just to emphasize, entails leadership, authority, and coordination of resources. Okay, how you're going to coordinate all these resources, this material, this machine, for example, in a company, or all these logistics with respect to planning and coordination, coordination and control, communication system, selection and placement of subordinates, training and development, and of subordinates, accountability and responsibility. How you're going to coordinate all these things. Okay, so that is management. Kaya nga, it's very hard to become a manager. It's very hard to become a leader because we have all this responsibility. You have all this authority. We have all this, what we call this one? All these accountabilities, no? If we cannot comply all these things based on the objective and the target, the mission or vision of your organization. Okay, so planning is very important. because things or activity without planning, it might not achieve the goals of that activity. Okay, then coordination and control, because from time to time, the activity of your organization will not only be done by your group or individually. So there might be a time that you are going to coordinate with other section division of your organization. And also, communication is very important. The verbal communication or the non-verbal communication. Those are the things how you're going to impart or deliver the objective without the knowing this communication system. Then also we have this selection and placement of subordinates. Now take note that especially if the activity is very sensitive, okay, of that organization, very sensitive, then take note that your subordinates that will work for it, they know and they understand, and maybe they are convinced to do these things. Otherwise, if they have different view or views with regards to a certain activity, then you might not achieve the goals of that activity. Training and development of subordinates. Now, even though they work for several years already in an organization, for whatever activity that you might have, it is maybe in order that you will conduct training and development for that specific activity, so that of course they know what they are what they will they know what they will do, no, to achieve all these things. But of course, management also entails accountability, no? Okay, so we know what is our accountability if we were not able to achieve this activity. Okay, or what is our accountability to what will happen to this activity or project that we are going to pursue, no, or to continue. And also the responsibility, our responsibility being managers, or towards the objective of the activity or organization, towards the responsibility towards our subordinates, and towards our other organization that being coordinated with us. Okay, so management resources. This includes, okay, I mentioned this one a while ago. This is resources may include human, okay, your people, your subordinates, your employees, your different managers, supervisors, line supervisors, and so on and so forth. Okay, and even your resources, your land, your building, and even your capital, financial, okay, those are other resources, or management skills in coordinating the use of these resources. Okay, so those are some of the resources that we are talking about a while ago. So this is tangible, non-tangible resources. Okay, so now let us proceed to health and safety management. Okay, so how it differs from the management that we are talking about a while ago. Okay, accordingly, it has no different from other forms of management. They are just almost the same. Okay, the management of the health and safety operation at this national and local level: planning, organizing, controlling, objective setting, establishing accountability, and setting of policies. The same thing that will happen. Okay, so we have this. Okay, so we have this. We have all these things here, no? So measurement of health and safety performance on the part of individuals at specific locations. So we should be able to measure. Okay, so kailangan alam natin, no, kung ano na ba yung performance ng health and safety natin. Okay, sa with respect to individual employees, or even in group employees, a certain group, ano bang nangyari sa safety and health ng mga tao natin with respect to the specific locations. Okay, so titingnan din natin yan, no? Kasi whether we like it or not, mayroong mga trabaho na nandun yan sa pinaka malapit sa prone to accidents, no, or hazards. So that is why we should have to consider the health and safety performance or individual or group in a specific locations. Okay, motivating also managers to improve standards and health and safety performance. Okay, because several managers, head of offices, don't care about safety, don't care about hazards, okay, health of their workers. Baka sabihin nila, okay, okay lang yan. Just take precautionary measures. Okay, okay lang yan. Kahit andyan na yan. So, just careful, okay? But being a manager, being the head of the office, then we should have to consider all these things to bring away or bring away our subordinates from this kind of risks. As I've said, if we cannot go away with it, then if we cannot limit, then we should have to reduce the risks. Okay. So management performance, as we mentioned a while ago, is concerned with people at all levels of the organization and human behavior also. In particular, human personal factor is very important. Okay, kasi unang-una, pag cautious lang yung mga tao natin sa health and safety and hazards against hazards, siguro wala namang mangyayari, di ba? So, human behavior here is one of the major factor on attaining good health and safety management in an organization. Okay, so human personal factors. Ano ba ito? Unang-una, attitude. Okay, attitude toward health and safety, attitude towards the work condition, the situation, okay, how they perceive or perception, okay, then how they are motivation, in other words, and then their personality, their learnings, okay, learning and training against a certain situation. Okay, so the management of health and safety is also concerned with organizational structures. Okay, of course, managers are concerned with the organizational structures. Ito po yung structure natin. It is a diagram of a position, then with the respective inherent power to that position. Ano ba yung trabaho that with this that belongs to this position? Okay? The climate for change within an organization. Pag sinabi natin climate dito, yung relationship with the other co-workers, peers, okay? So, yung relationship natin sa kanila, ano ba yung mga do's and don'ts? Ano ba yung mga, ano ibig sabihin dito? Yung mga barriers to perform the objective or the assigned task, no? So, what are the cause of the problem later? So, those are the climate change of the organization. Individual rules within the organization, yun nga, importante yun. Kasi if you do not know your job, if you do not know your responsibility, yung trabaho mo, you might encounter problems. So that is one of the concern that we should know as being a manager. The problem of stress which takes many forms. Okay, later we will discuss about stresses, no? And this is very important that we should have to identify stresses or yung tinatawag natin na stressors para more or less naman alam natin kung paano to fight back, and so that we will be able to help our employees, no? Our subordinates. Okay, so several questions must be asked at this stage. Okay, number one. These are some of the common questions anyway. So, are managers good at managing health and safety? Okay, so as I've said kanina, marami po tayong responsibilidad being managers and we are accountable to this. So, as being a manager, being the manager of that organization or company or office, then are we good in managing health and safety o di kaya wala tayong pakialam? So, hindi yan po pwedeng wala tayong pakialam, ha? So, we should have to consider health and safety of our company or organization. What is their attitude to health and safety? How they face this problem of health and safety? O baka sabihin nila, bahala na yung mga tao dyan. Wala naman akong pakialam dyan kasi wala naman ako dyan sa situation na yan. Okay? Is it of a proactive or reactive nature? When we see proactive, yung dapat unahan natin yung mga hazards na yan or yung mga risk na yan. Okay, so unahan natin, gagawa tayo ng paraan na maunahan natin sila. And it is differentiated or distinctive, no, or distinct against reactive, no, or nature. Because yung reactive nature, ibig sabihin, andyan na yan, mayroon ng resulta, baka na-injured na yung mga employees natin, baka nakasakit yung employees natin, ano bang gagawin natin for this injury and for this diseases and ailment, no? So yun ang reactive. Proactive wala pa. We have to think so that hindi mangyayari yung alam na natin na mangyayari, no? So number 3, how do their attitudes affect the development of health and safety systems? Okay, so yun ang isa, no, na tanong. So, ano ba yung attitudes nila? Yung how they face this kind of problems, no, related to health and safety. Number 4 is health and safety safety a management tool. Okay, so we have this management tool or a problem thrust to them by the enforcement agencies. So, is health and safety a management tool? Okay, to face this problem on the enforcement agencies in government. Okay, so how they coordinate, no? Halimbawa ngayon, dito sa tinatawag natin na COVID-19, how your organization coordinate with the this anti-COVID-19 agency, no? So, paano ba sila nakipag-coordinate dyan? Baka wala rin silang ginagawa. Okay? Wala silang ginagawa para sa yung sinasabi natin mga health protocols, the minimum health protocols. Kaya nga pag maganda yung management system natin, maganda yung pananaw ng managers natin, marami sila mga programs to fight against this COVID-19. Okay, and of course, coordination with these government agencies, this health agency, no, the government agency to fight against this COVID. Kung paano sila nakipag-coordinate, yun, doon makita natin kung mayroon ba tayong coordination with them, no, or mayroon ba tayong magagandang programa yung sa organisasyon natin. Okay, health and safety management in practice. While health and safety management covers many areas, there are a number of aspects which are significant. Okay, namely, we have the company statement of health and safety policy. Do we have company statement, policies, and guidelines with regards to health and safety? Yun, maganda yung tanong na yan. Then, mayroon na tayong mga procedures for health and safety monitoring and performance measurement. Baka magkasakit na lahat yung mga tao dyan, wala pa rin tayong ginagawa para to study, no, or procedure to monitor the health and safety performance of the organization. Clear identification of the objectives and standards which must be measurable and achievable by the persons concerned. So we have all these things, huh? So the system for improving knowledge, attitudes, and motivation. System of improving the knowledge, Ayan, ngayon na COVID-19, mayroon ba tayong sistema na para more or less naman malaman nila or they improve their information about COVID-19? Baka sa internet sa ano ba yan? Sa mga social media pa yun makakuha ng mga informasyon. Baka ang iba dyan, hindi na naman yan totoo. So, do we have this system to improve knowledge, attitudes, and motivation? And to increase individual awareness about these health and safety issues, responsibilities, and accountabilities to each and every one. Okay? So, another one is procedures for eliminating potential hazards. Mayroon ba tayo dyan? No? From plant machinery, substances, and working practices through risk assessment. Okay, mayroon ba tayong tinatawag na risk assessment? Gaano ba kadelikado yung trabaho? Gaano ba kadelikado yung sites and locations? Okay, dyan sa mga constructions, minsan o karamihan, makikita natin kahit naman lang hard hat, wala yung mga empleyado, yung mga trabahante, yung mga laborers. Wala din silang yung mga safety shoes. So paano ba yan? Pag mayroong mangyari diyan, baka mayroong mahulog diyan na yung mga metal saka yung mga mabibigat na bagay galing sa taas. Walang hard hat. So ano mangyari diyan? So hindi naman natin masasabi na bahala kayo diyan. Matitigas yung mga ulo nyo. Hindi. Kasi all this activity in the construction might be affected, no? So, halimbawa, yung work natin, kailangan ng 10 tao, nakuha yung isa kasi na-disgrasya. Siyam na lang. So, ibig sabihin, yung performance natin, reduce din yan. So, yun, that is very important that we should have to consider safety. Okay, so mayroon ba tayo niyan? Mayroon ba tayong risk assessment? Design and operation of safety system or safe systems of work and other forms of hazard controls. Okay, measures taken by management to ensure legal compliance. Okay, so because chapter 1, we are talking about legal requirements, principal legal requirements, and it should be governed by the Department of Labor and Employment or DOLE. And DOLE here, of course, I am very sure that they issued several guidelines, laws, and other legal basis against this safety and health management. Are we using or considering this or we comply all these legal what we call this one guidelines from the DOLE? Okay, so those are some of the questions. Now let's proceed to supervisors, health and safety. Okay, doon na tayo. Tapos na tayo sa manager. Dito na tayo sa baba. Okay, supervisors, health and safety. The most important of an effective supervisor in this respect can be summarized. Thus, we have this: introduction, instruction, demonstration, practice, monitoring performance, reporting, correcting, and encouraging. Okay, so of course, when we say introduction, you have to introduce health and safety management to your subordinates, even in the actual construction, for example. Then you have to introduce what are the safety guidelines, what are the safety requirements. Okay, so siguro every day or even not every day, maybe once a week, conduct. They call this one as yung bang tawag nila na ano ba yan? Box meeting. Ano yun? Box meeting. Yung mga lahat na mga laborers, lahat ng mga empleyado, lalabas yan, mag-meeting dyan sa labas. And prior to that meeting, maybe they have this calisthenics, they have this exercise, no? Conduct some exercising, no? So mag-exercise dyan for a few minutes. And then tell them, remind them, charge them to what they are going to do to maintain safety and health protocols while doing these things in the construction sites. Okay? Of course, instruction how to do this one. Baka yung iba hindi nila alam yun eh. So kailangan pa natin ng mga detailed instructions. So paano ba tayo pag magtrabaho na tayo sa taas, second floor for example? So yun, you have to instruct them. Huwag kayong aakyat without harness, without hard hat, without safety shoes, so on and so forth. instruction is very important. And not just telling, not just talking, but of course, you have to demonstrate how to do this one. Okay? Pero mahirap natin mga Pilipino, kahit walang harness, aakyat yan. Kasi sabi pa nga nila, disturbo lang yung mga harness na yan. Mabibigat lang sa ulo yung mga hard hat na yan. No? Hindi nila tinitignan, kinoconsider yung baka mayroong mangyayari sa kanila. Baka, ayun, matamaan sila ng mga hard na mga bagay doon sa ulo nila. Yan, madidisgrasya pa tayo. So, kaya nga, it is very important that you have to tell them. Okay? Introduce, instruct, then demonstrate. But of course, not just until demonstration. We have to require them to practice it. Okay? Baka maganda lang tayo sa salita, maganda lang tayo sa demonstration, pero hindi natin pinapractice. Yun nga po, yun ang problema. Paglabas ni sir, ng safety officer, pag nawala na si safety officer, tinanggal yung hard hat. Kung wala na si sir, wala na yung safety officer, hindi na gumamit ng harness. Okay? So you should have to practice. Then, of course, not just requiring them to practice, we should have to monitor them. Okay, siguro sa mga construction na yan, it is required, no, to have this safety officer. So, itong safety officer na, si Sir Officer, siya po yung in charge sa pagmomonitor kung talaga bang gumamit or nag-apply ba ng safety protocols yung mga empleyado natin. Okay? Then, correcting and encouraging. If we found out that there's something wrong with the practice or the application of these minimum health protocols inside the organization or inside the workplaces, then we should have to correct that. Okay? And encourage them to practice all these things. So, alam ko, marami tayong ganyan, no? So, mayroon pa tayong mga signages dyan. Okay? So, safety first, parang ganon. Sa mga workplaces, safety first. Pero pag titignan natin yung mga empleyado, kahit yung sila ni Sir, walang ang helmet. So, yun, problema yan, no? So, isa yan sa mga problema natin na kailangan natin na i-inculcate doon sa mga ulo ng mga empleyado natin from the top to bottom that we should have to consider health and safety management. Okay, so we have this block diagram of successful health and safety management. So yung una dito, yung dito sa may taas, no? You have policy, organizing, planning and implementing, measuring performance, and reviewing performance. Okay, makita nyo dito sa kabila, feedback to loop improve performance. Mayroon tayong feedback dito, no? Makita niyo. Hindi kailangan yung feedback natin na from the beginning always, no? Baka sinasabi natin na dito lang sa organizing this safety management, dito lang tayo nagkamali. So, diretso na tayo dito. So, organizational development, baka obsolete na yung sistema natin, yung programa natin. Dito tayo sa to develop this organizing. Okay? Or baka developing techniques and planning, measuring, and reviewing. So, dito tayo sa tinatawag natin sa feedback natin. Okay, dito sa kabila, mayroon din tayong tinatawag na auditing. Ito po yung trabaho natin. Dito po tayo mag-measure the performance ng safety and health management natin. So, we have to audit the policy, we have to audit organizing, we have to audit the plan and implement how it is implemented. Baka mayroon tayong problema dyan, then we should have to consider this one. Okay, so the last one here is the reviving performance. Anyway, we will discuss this one by one. Talking about policy. So ano po ba itong policy? Organizations that are successful in achieving high standards of health and safety have health and safety policies, okay, which contribute to their business performance while meeting their responsibilities to people and environment in a way that fulfills both the spirit and the letter of the law. Okay, so it's very clear, no? Na malaki yung may tutulong ng palisiya ng health and safety policies natin kung mayroon man tayo. So, kailangan mayroon tayong policy. Then, organizing. These achieve high health and safety standards are structured and operated so as to put their health and safety policies into effective practice. So, yun nga, you have to organize a certain group, committee for example, safety committee for a certain group, no? So, siguro, ang unang-una, kailangan natin ng safety officers. Yung safety officers na, andyan ng lahat, no? Mayroon, qualification, it's very important. Mayroon ba yung training na yan? Mayroon ba siyang mga certificates or training na pinagdaanan, no? And updated ba yun, no? So, these safety officers and the rest of the committee will help to practice, no? To help to implement, okay? To implement these safety policies, okay? Planning also in relation with safety. The successful organization to adopt planned and systematic approach to policy implementation. Okay, so sabi ko nga, hindi basta-basta lang yung pagpaplano, no? Yung implementation ng safety. So the successful organization adopt a planned and a systematic approach of this policy implementation. Their aim is to minimize the risk created for activities, products, and services. Okay, so measuring performance also. So that is the next one. You have to measure the performance of the safety programs. Okay, so performance in organizations that manage health and safety successfully is measured against predetermined standards. Kaya nga, doon tayo sa tinatawag natin na planning period, we have to set the standards, safety standards, then try to measure if we are passer of these standards. So we should have to measure this one. Okay, so let's proceed to auditing and reviewing performance. No? So this is the ano yan, sa left side ng yung structure natin na mayroon tayong tinatawag na auditing, no? Learning from all relevant experiences and applying the lessons learned are important elements in effective health and safety management. This needs to be done systematically through regular reviews of performance based on the data, no? So we have this based on the this is based on the data both from monitoring activities and independent audits of the whole health and safety management system. So ibig sabihin na from time to time we should have to consider, we have to study the data taken from the day-to-day activities of the organization or a company. Okay, that is why maybe you might experience if you are going to visit some industries or company, mayroon silang inilagay dyan sa labas, zero accident within 365 days. So, ibig sabihin, walang nangyayaring aksidente within 1 year, no? So, why you are going to place this one, this information? Okay, of course, so that your maybe your clients will say na, oh, safety tayo dito. Walang problema dito. Walang mga problema tulad ng mga against accidents, harsh, or these hazards, so on and so forth, no? So we should have to consider this one also. Okay. So we have this quality management and health and safety. Okay, ano ba yung mga quality management natin? The aims of this standard are to improve the occupational health and safety performance of our organization in order to, number one, we have minimized risk to employees and others. As I've said kanina, if we cannot eliminate risks, then of course we have to minimize risks, reduce our risks. Okay, improve business performance. Okay, so that is why we have this quality management for this health and hazards or health and safety. Okay, improve business performance. Kasi pag dyan sa negosyo natin o dyan sa construction, for example, sa engineering, pag maraming mga mangyaring disgrasya, of course, you have all this responsibility and accountability to help your employee. Okay, pag ma-hospital yan, then you should have to give counterparts, no? Para sa gasto niyan sa pag-hospital. Okay, so yun, pag mayroong mangyayari, ayan, dagdag na naman yung problema financially, and it will reduce the the output of the company because okay, nakuha na yung ibang mga empleyado natin, nawala yung empleyado natin. Sana ganito karami yung mga trabahante natin ngayon, nawawala na yung iba kasi doon sa hospital. So it will reduce the output, no, this man-sized job. Okay. So, assist organizations to establish a responsible image in their workplace. Ayun, sabi ko nga kanina na maraming mga company na maglagay ng mga announcement dyan na zero casualty, zero injury within this 3 months, so on and so forth. Okay, so ayun, para more or less naman tataas yung moral or tsaka yung image, gaganda yung image ng workplace or your company natin. Okay, so let's discuss benefits. Ano po ba yung mga konting benefits pag mayroon tayong magandang health performance sa organization? Okay. So, unang-una, improve the commitment from staff and positive support from trade unions. Okay, alam niyo ba yung mga unions na yan? Minsan nga, yung mga unions na yan pang problema ng company. Okay, wala tayong magagawa niyan because these unions, these organizations, these labor unions are protected by law. Andiyan yan sa Labor Code of the Philippines, labor law, na they are authorized to create organization within themselves to protect their employment maybe, no? So siguro pag satisfied when it comes to health and standards or health and safety, yung mga empleyado natin, wala tayong problema sa mga union na yan, no? So baka mayroon pa tayong mga positive support galing sa kanila, di ba? So reduction in staff absenteeism. Okay. Ayun, palaging nakasakit yung mga staff natin, yung mga empleyado natin. No? Siguro, pag maganda pag mayroon tayong programa, pag maganda yung performance ng health and health programs natin, siguro reduce also the absenteeism of our organization or our staff and employees. Improve production output. Ayun, production and output will improve. No? Through reductions in downtime from accidents. Okay, so it's very clear. Reduction in insurance premiums. Ayun nga, pag maraming magkasakit, so magagamit nila yung insurance nila. Pag mayroon silang nagamit na yung insurance nila, kawawa na sila doon. Okay? So, we should have to improve our safety management. Okay, confidence also to the customer. Ayun, yung mga clients natin, sinabi ko na yan kanina, confidence na siguro dahil magandang safety performance dito sa company na to, we are confident to transact business with them. Okay? Reductions in claims against the organization. So, yung mga claims ng health, claims ng kahit ano related to accidents, no? And reduction in adverse publicity. Okay, masisira na yung reputation ng company natin pag wala tayong magagandang mga health programs. Okay, so making good progress, no? Making good progress. The way forward for successful health and safety management is to involve everyone in the organization. It's very clear, no, that we should have to involve everybody in an organization in this health and safety management. Okay, using a proactive approach to identify hazards and to control these risks are not tolerable. It's very clear. Okay, so we should have to involve our employees in managing this safety and use this proactive, not reactive, no? Not reactive. Of course, you have to react whenever it really happens because we cannot do about it, no? Kung mangyayari yan. Kasi that is beyond the commerce of man. Accidents, injury, hazards, or this injury, this kung anong mga aksidente dyan, that is beyond the commerce of man. Wala tayong control niyan eh. So, pero we will be able to do something to minimize this hazard. So, first thing to do, proactive to identify hazards and then control this risks so that kung mangyayari man yan, so konti lang o maliit lang yung effect sa company natin. So, status review of the health and safety management system. So, ano pa itong mga ano ba ito, mga review, no? Status review. So, unang-una, requirements of relevant legislation dealing with occupational health and safety management issues. Requirement of relevant legislation. So, kailangan natin ng mga legislation or creation of procedures and yun sa mga program natin, yung mga health programs natin. Okay? Existing guidance on occupational health and safety management within the organization. Guidance on occupational safety on the existing, no? So, we should have to improve. We should have to study kung kinakailangan. Kung tatanggalin natin yan, ibahin natin yan. So, ibahin natin yan. Pero kung doing well, then we have to try to improve anyway, based on the present condition. Okay, so sabi nga natin, from time to time, mayroon tayong mga naobserbahan na mga bagong fenomeno na it will challenge our health and safety. So we should have to study this one and make things in order so that we will be able to limit all these things, all these risks to reality, no? Malimit natin yan. Best practice and performance in the organization's employment sector and other appropriate sectors. Okay, so ano ba yung mga best practices natin? Alam ko, each organization, they have their own best practices talking about safety and health programs, no? Efficiency and effectiveness of existing resources devoted to occupational safety and health management. So, ibig sabihin, ano ba yung mga resources na ginagamit natin, yung pinag-usapan natin kanina, then we should have to try to evaluate if this is efficient and still is these things are effective. So, efficiency, yun, pag ano yung desired output, then do we able to attain that desired output? So, are we efficient to do these things? Okay? Are we effective? Kung ano ba yung iniisip natin na output, talaga bang na-achieve natin ang output na yan, no? With regards to health and safety. Okay, so yun ang sinasabi natin, efficiency at saka effectiveness ng existing resources which is devoted to occupational safety and health. Okay, so we mentioned a while ago about planning requirements, no? Ano po ba yung mga planning requirements? So ano ba yung dapat nating ipaplano? Okay, so we have these principal requirements for planning. Risk assessment, na-mention natin yan kanina. Try to evaluate, try to assess, try to determine, try to identify what are the risks dyan sa workplaces natin. The organization should undertake risk assessments including the identification of hazards. Kung talagang hazard yung hazardous yung trabaho natin, yung sites and location natin, then we should have to think how to manage this risk and to these hazards. Legal and other requirements. Okay. So, as I've said kanina, mayroon tayong mga principal legal requirements based on Book 4 of the Labor Code of the Philippines. Yun lang po yung yung nababase natin doon, no? The organization should identify the legal requirements in addition to the risk management applicable to it and also any other requirements to which it subscribes that are applicable to occupational health and safety management. Okay, so yung iba, hindi yan makikita dyan sa Labor Code of the Philippines. Pero like now, no, talking about this COVID-19, this pandemic, we have several policies of this group of the health agency, okay, the Department of Health, fighting against this COVID-19, and we should have to follow this one. This time, we are still in the, what we call as yung tinatawag natin na emergency, health emergency. This time, we are under health emergency. Ibig sabihin, para bang martial law yan eh. Pero yung martial law is yung military above sa tao. Pero ngayon, yung sa mga health mga health agencies like Department of Health, sila yung nasa taas. Kung ano yung sinasabi natin, o yung sinasabi nila, dapat sundin natin. As an organization, we should have to consider all these protocols na sinasabi nila to fight against this COVID-19. Okay? So we have to subscribe what are the applicable occupational health and safety management protocols. Okay, so ito po yung ilan pang mga principal requirements for planning. Unang-una, occupational health and safety management. The organization should make arrangements to cover the following key areas. Overall plans and objectives. Okay, including personnel and resources for the organization to achieve its policy. So, mayroon tayong plano, organizational plan, okay? And objectives, including personnel and resources. Okay, for the organization to achieve this policy. Have access to sufficient occupational health and safety knowledge, skills, and experience to manage its activities safely and in accordance with the legal requirements. Okay, so pangalawa yan, no? So, sufficient occupational health and safety knowledge. So, we need to have skills training, workshops, okay? So, kailangan natin yan. Then, in accordance, of course, in illegal requirements. Operational plans to implement arrangements to control risk identified and to meet their requirements. Okay, so operational plans. But ibig sabihin, we should have to think of how it is implemented, how this programs or policy of the company regarding health and safety, occupational health and safety to be implemented, no? Upon identification of the different type of risks. Okay, so we have this planning for operational control activities. So what are the control? How you're going to penalize? How you're going to control so that everybody should follow these programs. Okay, planning for performance measurement and corrective audits or corrective action audits and management reviews. Ibig sabihin, we have to think of how to measure, how to test, how to evaluate. So kasama na yan, no? Then corrective actions if necessary. Okay, so audits and management reviews and implement corrective actions shown in to be necessary. Now let's proceed to risk assessment process. No? So risk assessment process. So we have these processes here. Okay? Unang-una, classify work activities. Ano ba yung mga trabaho? Identify hazards. Okay, within that ano ba tawag yan? Workplaces. Try to identify kung ano ba yung mga hazardous dyan sa workplaces natin. Then determine also the risks. How risky is it? No? Decide if risk is tolerable. Ayun nga. Kung kakaya lang natin o hindi natin kaya, o parang ganon. If we cannot, if the risk is malalaki yung effect, no? Malalaki yung effect sa mga tao natin, siguro we have to think of other action plan. Okay? So we should have to prepare. That is the next one here, no? We should have to prepare this risk action plan kung necessary lang naman. Okay? Then review the adequacy of the action plan. How adequate it is. Okay? So baka yung mga action plan natin is not adequate or hindi match doon sa kinakailangan. Baka kulang pa o di kaya baka hindi tama ang pamamaraan. So we should have to check that one. Okay? So we have next we have this effective implementation, no? So effective implementation of these programs. Now, there must be a total commitment of from the board and senior management downwards to effective implementation operation. Of course, yes, that is very important. Pag walang commitment, pag walang pakialam yung nandun sa taas, malaki yung problema natin sa organization. To ensure that everyone recognizes their individual and collective responsibilities, a number of key issues that must be addressed, like structure and responsibility. Okay, so we should have to identify the structure, identify the position, and what are the responsibility inherent to that position. Are they trained and aware, and are they competent to do these things, health and safety related activity? Baka hindi sila yung mga tao na walang training o di kaya walang alam sa safety. Okay? And then the communication is very important also. How you're going to impart, you're going to tell them if there is something wrong with the communication na system ng tao or doon sa organization natin. Okay, so occupational health and safety management system documentation. Ayun nga. So kailangan natin 'yan. So these are some of the ways to have this effective implementation. And to ensure that everyone recognizes their individual and collective responsibility, we have these things, additional thing. Document control. Okay, so document control, operational control, emergency and preparedness and response. So kaya nga kahit doon sa mga local government natin, mayroon tayong mga municipal disaster ano ba 'yan, yung mga reduction, no? Mga preparedness, 'yun nga, RRMO. Okay, so mayroon din tayong mga yung sa mga municipal lang, no? Sa mga lungsod natin. So mayroon tayong mga emergency response team kung kinakailangan, mga rescuers natin. So kailangan mayroon tayo diyan, no? So kailangan yung preparedness natin is sufficient and efficient. Okay, for as needed, no? Kaya nga kailangan sa mga company natin, kailangan natin ng ambulansya, kailangan natin ng mga equipments, no? Rescue equipment, so on and so forth, para mayroon din tayong magagamit pag mayroon tayong mga sakuna na mangyayari. Okay? So that's it, effective implementation. Now let's proceed to risk management. Ano ba yung risk management? It's defined as the elimination or minimization. Okay? I-minimize the adverse effects of pure and speculative risks to which an organization is exposed. Okay? So, ibig sabihin, mayroon tayong tinatawag na elimination and minimization. So, kung hindi natin ma-eliminate, sabi ko nga kanina, at least man-minimize lang yung mga adverse effects ng risks andyan sa organization natin. Halimbawa ngayon, trabaho natin gumagawa ng mga chemicals para sa spray sa farm natin. So, risky yan. Wala naman tayong magagawa kasi yun ang trabaho natin, yun ang produkto natin. So, if you cannot eliminate yan dyan, then you should have to try to increase your procedure and programs to minimize the adverse effects of these risks. Dalawang risk natin, tinatawag na risk. Mayroon tayong pure and mayroon tayong speculative risk. Okay, so ano ba yung pure risks? Ito po yung this results to the lose to the organization. Okay, so ibig sabihin, this is a risk that walang mangyayari dyan, lahat losing, lahat mawawala yung effect ng ganyan. So, yung speculative risk is the result here is either gain or loss. That minsan, kahit nga mayroong nangyaring risk, pero makagain naman tayo, no? Makagain naman tayo. So, hindi lahat, no, risk na losing tayo. Minsan, mayroon din tayong gaining. So, yun pong tinatawag natin na speculative risk. Dahil dyan tayo nabubuhay, dahil yun ang nature ng trabaho natin. So that is speculative risks. The role of risk management. Ano po ba yung mga role ng risk management? Consider the impact of certain risky events on the performance of the organization. Ano po ba yung impact ng risks diyan sa performance ng organization to attain the objectives of the organization? Devise alternative strategies for controlling this risk and for impact in the organization and or their impact in the organization. So, devise all the alternative strategies. Okay, so think of the strategies. Think of the program that will help to minimize these risks. Okay? Relate their alternative strategies to the general decision framework used by the organization. Okay, so general decision framework used by the organization. So yun po ang role ng risk management. More or less, we will be able to relate, okay, these alternatives, okay, or strategies, no, to the general decision framework na ginagamit natin sa ating organization. Okay, so identification of the exposure to risk. Okay, paano ba yan? Sabi natin kanina, you should have to identify the risk, no? We should have to identify the risk. You should have to identify the hazards. Okay? It requires a knowledge of all the assets, both tangible and intangible assets. Okay, yung mga resources natin, dapat alam natin. The sources of direct and indirect earnings. Okay, so kailangan natin yan kasi pag yung trabaho natin, yung negosyo natin, yung business natin is andyan sa risk or hazards na yan. So, you should have to consider that one, no? The liabilities imposed under both common and statute law or statutory law. Okay, the legal impediments in relation to this kind of risks. Okay, so these are the process, no? So, dapat malalaman natin na kaya halimbawa, yung trabaho natin, yung negosyo natin, within that risk, no? So, hazardous yung trabaho natin. Dapat, are we complying to the laws, no? The legal impediments that we might encounter as we continue our business. So, think about it. Try to identify how hazardous is our what we are doing. Analysis and evaluation of the risks. So, okay, so that is the other one. So, try to evaluate, try to analyze. If that is really risky, if not so, then try to think of any programs that will more minimize or reduce these risks. Okay, a number of questions, no? A number of questions that must be asked, no, at this stage of risk management process. How frequently will the loss occur? Kung mayroong nangyari na problema, okay, gaano ba ka, yung frequency na nangyari yan? Every day, every other day, or every week, or every month, or once a year. So, okay lang yan. So, we should have to do a program which good for an annual activity that will remind us to fight against this risk. Okay, what is the predictive severity of the loss? Okay, how severe is the result of these hazards and risks? What are the legal and practical implications? Okay, so if kung mayroong nangyari na ganito, dapat alam natin kung ano ang gagawin natin in compliance to the different provisions of the labor code, to the revised penal code, or if you might experience na makaproblema tayo sa mga tauhan natin, siguro sa doon sa mga mga kaso, no, sa mga against sa mga tauhan natin, no. So we must have to be ready how to solve problems in relation to this. Okay, so like for example, accidents such as the death of an employee, major escalating fire, for example, or a pollution incident. So we will be fighting against DNR, the Department of Environment and Natural Resources, so on and so forth. So we must have to be ready with this for this what we call as a practical or legal implications. What is the likelihood of the loss as arising? So gaano ka yung possibility na mangyayari? So is it really talagang mangyayari yan araw-araw kapag gano'n? Okay, so we should have to do this evaluation. Okay, so try to ask this question. What particular groups of employees or members of the public could be affected by the incident? So ano bang grupo? Ano bang bracket ng mga, halimbawa, at what age, no, mangyayari itong ganitong mga risk na yan? So siguro mangyayari ito sa mga medyo mga mga bata na mga empleyado pa, no? Mga bata pa na mga empleyado, di kaya sa mga matatanda na or retirables na. So siguro we should have to study this one, no? Because if that will be the case, then we will not let this group of employees nga gagawa niyan. Okay? Kung mga bata, di lagyan natin ng yung mga medyo matured na. Or yung pag nangyayari yung risk na yan, yung mga accidents na yan, doon sa mga medyo may edad na, di huwag natin lagyan ng mga retirables so mga employee natin diyan. Okay, so that is what we are going to do and those are some of the questions. Okay, so prevention or control of the risks. Ano pa ba yung gagawin natin para ma-prevent man lang? Or we should have to limit. Okay, people involved in risk prevention or control. We have the production manager. That is very important. No? Siya yung isa doon na kailangan be very concerned, that should be concerned on health and safety. No? Alam niya yan. To ensure products meet specifications. Company legal executive, yan, para for legal requirements, okay, for compliance of any provisions, okay, ng law natin, no? So, to protect the organization from criminal prosecution and civil liabilities. Okay, para alam natin na paano to counter, okay, maybe. So, yun po, sabi natin ngayon na kailangan proactive tayo, no? So, yun nga. So, siguro, labor-related cases, no? So, mayroon tayong mga company legal executives. Accountant also. Now, these are concerns on financial assets. Okay, so para maprotektahan tayo ng against fraud. Okay, so kailangan mayroon tayong accountant, no? Security managers also. Okay, of course, your security directors and head of the security force, no? To protect organizations, trade secrets, and others. Okay, so maprotektahan din tayo. Kailangan natin ng isali natin doon sa prevention and control, risk prevention and control. Isali din natin doon yung mga company security guards natin. Okay? So siguro sila yung magko-coordinate doon sa mga sa PNP natin, sa mga police, no? So yun, kailangan natin ng security manager kasama doon sa team or sa organization. Okay. Health and safety advisor. So this is one of the most important person, okay, to ensure compliance with the relevant health and safety procedures. So dapat kailangan natin okay, safety requirements. Sila kasi yung nakaalam kung paano, no? So that is why as I've said kanina, in any organization, even sa industry, even sa company, or even sa mga kahit sa opisina, kailangan natin ng safety officer kasi sila yung in charge, sila yung may alam related to safety and health programs. Okay? Techniques of risk management. Unang-una, identification of risks. Pangalawa, yung evaluation. Pangatlo, yung economic control. Okay, so yun ang management, no, risk management or techniques. Okay, so mayroon tayong tinatawag na risk management strategies. So risk avoidance. Okay, if we know that it is really risk, then let us avoid it. Okay, so mayroon din tayong tinatawag na risk retention. If we cannot avoid it, then retain the risk. But of course, risk retention with knowledge, of course. Kailangan alam natin kung paano. And alam natin kung paano kukontrolin itong risk na ito. Because andun na yan wala tayong magagawa. That kind of risk is in there. Kasama yun doon sa trabaho natin. Sa company natin, yun ang trabaho natin. Okay? So, but if you're going to retain that risk, then we have this knowledge. Of course, risk retention without knowledge, meron din yan. Okay, kasi we must sometimes be more conscious, no? We cannot perform if we have all this retention of this knowledge. So, minsan nga kinakailangan natin na wala tayong knowledge na ni-retain pala natin yung risk na yan para hindi naman tayo masyadong mag-worry and it will affect our performance. Okay, so if this risk is retained, or do we have number 3 here? Strategy is risk transfer. We have to transfer the risks to other people, to other agency, to other group, or to other industry or company. Okay, transfer the risks. Okay, so halimbawa, yung trabaho natin masyado naman talagang hazardous, then we have to insured. Okay, insured yung mga machines natin, insured yung mga trucks natin, yung mga transportation services natin. O sa kanila na yon. Okay? So halimbawa yung transportation ng yung trabaho natin nandoon sa pinakabundok, kailangan natin ng doon tayo magtatrabaho kasi yun ang nature ng trabaho natin. So pag ang risk doon is the transportation, siguro kukuha tayo ng transportation service para yung related to transportation sa kanila na yung risk, hindi sa atin. Okay? So yan, example yan sa to transfer the risks. Okay, so or insured, no? I-insure natin yung mga empleyado natin para yung risk ng possible financial, ano ba tawag niyan, babayaran pag mayroong mangyayari halimbawa. So sa insurance na yon, insurance ang bahala doon. Okay, then reduction also, so it's very clear. Risk reduction. So yun nga, if we cannot do about it, then try to reduce. If you cannot eliminate, if you cannot avoid it, then try to reduce these risks. Okay, so how to do this? Of course, learnings, trainings, development. Okay, bibili tayo ng mga equipment to fight against these risks. Okay, so I think we discussed all these things. We discussed this chapter with regards to health and safety management. Okay, so again, thank you very much. And if you think that you learned something with regards to the discussion that we have on safety, on health management, then please subscribe my YouTube channel and click that notification bell so that whenever new video in this subject that I will upload to this YouTube in my channel, you will be notified. Once again, good morning, and I hope that you learn many things, and see you on the next chapter.
We are one in IIE mission and vision, instilling excellence in electrical profession, having a dynamic professional association, making innovative contributions to our nation. Rising to any challenge, involving what's comes and walks. BEERE